Hey everyone, welcome back to Graft Academy. Today we're talking about one of the most important questions patients ask. What is the safest bone graft material? It's completely natural to wonder what's being placed in your body. Whether your graft came from your own bone, a donor source, an animal source, or a synthetic material, safety is the number one concern in every dental and surgical setting. Let's walk through exactly how each material is tested, regulated, and proven safe, and why bone grafting today is one of the most trusted procedures in modern dentistry. First, it's important to know that all bone graft materials used in dentistry are regulated medical devices. That means they must meet strict safety standards set by organizations such as the Food and Drug Administration, FDA, in the United States and equivalent agencies in other countries. Before a graft material ever reaches a dental office, it goes through rigorous testing for purity, sterility, and biocompatibility, meaning how well it interacts with the human body. Let's start with the most natural option, autografts. An autograft uses your own bone, often from your chin or jaw area. Since the material comes directly from your body, there's zero risk of disease transmission or immune reaction. It's considered the gold standard for safety and integration because your body immediately recognizes it as its own tissue. Next, allografts, which come from human donor bone. These materials are sourced through accredited tissue banks that follow the highest safety and ethical standards. Before being accepted for use, each donor is thoroughly screened for medical history, health conditions, and infectious diseases. The bone is then sterilized and processed through multiple steps, such as freeze-drying, chemical cleaning, and irradiation, to ensure complete safety and stability. By the time it reaches your dentist, it's sterile, non-living mineral tissue that your body can safely remodel into new bone. Allografts have been used safely for decades in orthopedic, dental, and reconstructive surgery, with millions of successful cases. Now let's talk about xenografts, which come from animal sources, typically bovine or porcine bone. These materials undergo extensive purification to remove all organic components, leaving only the mineral framework that closely resembles human bone. What's left is pure calcium phosphate, the same mineral found in your own bone. This framework is completely sterile, non-reactive, and biocompatible. Because it integrates slowly, it provides excellent stability over time and has been used safely in dentistry for more than 30 years. Then there are alloplasts, which are fully synthetic grafts made from laboratory materials like hydroxyapatite, tricalcium phosphate, or bioactive glass. Since they contain no biological tissue, they carry zero risk of disease transmission or immune rejection. Their composition is designed to mimic natural bone minerals, and they're completely sterilized during manufacturing. Alloplasts are ideal for patients who prefer a fully synthetic option. No matter the source, every material is designed to be biocompatible, meaning your body accepts it naturally without triggering inflammation or rejection. Once placed, your body gradually replaces the graft with living bone through a process called remodeling. The graft serves as a temporary framework, guiding your own cells to grow new bone and then disappearing over time. It's also important to note that the risk of infection or rejection from a modern bone graft is extremely low. Most complications occur not because of the material itself, but due to poor healing conditions such as smoking, uncontrolled diabetes, or inadequate oral hygiene. That's why dentists carefully review your health history before performing a graft, to make sure your body is in the best position to heal successfully. From a safety standpoint, all four types of graft materials, autograft, allograft, xenograft, and alloplasts, are safe and reliable when properly selected and handled. Each one passes through quality control systems that ensure sterility, traceability, and long-term safety. That's why bone grafting has become such a routine and trusted part of implant dentistry today. So which is the safest? The answer depends on your personal situation. Autografts are biologically safest since they come from you. Allografts and xenografts are scientifically proven to be sterile and safe after processing. Alloplasts are chemically pure and carry zero biological risk. In other words, they're all safe. What matters most is matching the material to your anatomy, your comfort, and your dentist's treatment plan. To summarize, modern bone graft materials are among the safest biomaterials used in medicine. They're sterilized, regulated, and supported by decades of clinical success. Your body recognizes them, integrates them, and replaces them with living bone. That's why today, bone grafting isn't just safe. It's predictable, effective, and essential to long-term implant success. If you found this video helpful, make sure to like it, subscribe to Graft Academy, and share it with someone curious about dental bone graft safety. We post new educational videos every week to help you understand modern dentistry in simple, clear language. Thanks for watching, and we'll see you in the next episode.